Hello, let's discuss Fishman's skeletal maturity indicator, a topic from orthodontics. But before we proceed, let's get to understand what exactly is a skeletal maturity indicator. So whenever we have to treat a case of for orthodontics, a case of malocclusion, we need to know the exact skeletal age of the patient. So knowing just the date of birth or the chronological age does not help because every individual has a different growth pattern, different maturation pattern. So it is essential that we need to understand the skeletal age of the patient. So for that there are certain indicators called as the skeletal maturity indicators, and there are various methods to evaluate the skeletal maturity. So the skeletal maturity indicators that are most commonly used, one is the hand wrist radiography, the others are the cervical vertebrae which is used, and even tooth mineralization, clinical and radiographic examination of tooth mineralization has also been used to assess the skeletal maturity, right? And of all these methods, hand wrist radiography is one of the most widely accepted method. Under hand wrist radiography, various people have given various techniques. There is Atlas method by Grulich and Pyle, Jork, Grave and Brown method. There is Singer's method, Hag and Teranga's method, and also Fishman's skeletal maturity indicator. So in today's session, we'll discuss about Fishman's skeletal maturity indicators. But before we proceed with Fishman's method, we need to understand a bit of the anatomy of the hand wrist. Okay, so what exactly is the anatomy of the hand wrist? So the entire hand wrist is composed of 4 groups of bone. So the first group is the ends of the long bone, that is the radius. So as you can see here, the radius and the ulna. So how do you understand the positioning of the radius and ulna? So they say when you stand in the anatomical position with your hands down and the palms facing the front in the anatomical position, the ulna is in the medial aspect and radius is in the distal aspect. That's the ideal way to explain it. But for you all to understand it a bit better, just understand that the radius is always in line with the thumb. Okay, so that is the exact positioning of the radius and ulna. So those are the first 2 bones that comprises of your hand wrist. Other than the radius and ulna, the next set of the bones that is there, those are the carpels. So carpels are 8 bones that you see over here. You all can make out over here. So these bones that you see here, those are the carpels. So among the carpels, we have proximal carpels and distal carpels. So always remember one thing, proximal carpels are the one which are towards us and distal ones are always away from us. So the ones that I've marked over here, that is the proximal carpels. So which are those? So the ones that I've underlined over here, scaphoid, lunate, triquetral and pisiform. Those are the proximal carpels. So one is not visible over here in the image. Okay. So for you all to remember it better, you all can remember the code word school trip. Okay. School trip or any other code that you all can make just to remember things. So in school trip, S for scaphoid, L for lunate, tri for triquetral and P for pisiform. The next 4 carpels that is there, these that you see here, those are your distal carpels. They constitute of trapezoid, trapezium, capitate and hamate. Okay, so yeah, capitate and hamate. So those are the distal carpels which are there. After that, in the palm, the bone of the palm are formed by these bones that are called as the metacarpals. They are miniature long bones, and then the fingers are constituted by what is called as the phalanges. Okay, and in the phalanges, every finger has 3 phalanx. One is the proximal phalanx, the middle phalanx and distal phalanx. The distal and proximal, the same applies which we mentioned for the other bones. Distal is away from us, proximal is towards us. Okay, and all fingers except the thumb has 3 phalanxes. The thumb does not have a middle phalanx. So that is the basic anatomy of the hand wrist. So moving ahead with Fishman's skeletal maturity indicator, it was introduced or given by a person called as Fishman, Leonard Fishman. He used 4 stages of bone maturation. So in his 4 stages, before explaining his 4 stages, it is essential that we know what an epiphysis is and what a diaphysis is. Okay, so the diaphysis is the shaft of a long bone and epiphysis is the rounded end of the long bone. So if a bone is this way, so right, so this portion is the diaphysis, the rounded end is the epiphysis. Okay, so the 4 stages of bone maturation that Fishman has given, the first stage is where the epiphysis is equal to the diaphysis. When I say that, I am talking about the width of the end. The epiphysis and the diaphysis is equal. In between there is a stage where there is appearance of a bone called as the adductor sesamoid. Then comes the epiphysis capping the diaphysis, and then comes fusion of epiphysis and diaphysis. Those are the 4 stages of bone maturation which are used in Fishman's index. Okay, and there are 11 skeletal maturity indicators given by Fishman. So let's see what exactly comes under Fishman's skeletal maturity indicators. So as we already mentioned, the 4 stages, the epiphysis is equal to diaphysis, appearance of the adductor sesamoid, epiphysis caps the diaphysis, fusion of epiphysis and diaphysis. Okay, so under these 4 headings, we have many stages. So the first 3 stages, what you see is the epiphysis will be equal to diaphysis. So let us quickly look at which are the first 3 stages. So you can see the image over here, 1, 2 and 3, correct? So what exactly is 1? So before we proceed with that, what we need to know is the numbering of the fingers. So thumb is 1, then comes 2, your middle finger is 3, 4 and the little finger is 5. Okay, that's a numbering of the fingers. So the first index is PP3. So what is PP3? Proximal phalanx of third finger. This is the proximal phalanx, right? Correct. Now moving ahead, 2 is middle phalanx of third finger and 3 is middle phalanx of the fifth finger, right? So an ulta L. So that is the first 3 stages wherein the epiphysis will be equal to the diaphysis. Okay. The fourth stage that you see, that is the appearance of adductor sesamoid of the thumb. Then comes the next grouping where epiphysis caps the diaphysis. It goes as an ulta L over here, 5, 6 and 7. Okay. So ulta L from top to the side. So DP3 means the distal phalanx of third finger, middle phalanx of third finger and the middle phalanx of fifth finger. Right? DP3, MP3 and MP5. Then comes the next stage, which is the fusion of epiphysis and the diaphysis. So under fusion of epiphysis and diaphysis, it starts from the distal phalanx of third finger, proximal phalanx of third finger, middle phalanx of third finger, all of the third finger only, and then down there is fusion of epiphysis and diaphysis of the radius. So that is the stages of Fishman's skeletal maturity index. What you could do is you could take up your own palm and draw lines. So that will be easier for you all to understand it. Okay. So I hope that is clear for you all. Just go back to the video once more. Listen to it once more. It will be easy for you. You get a lot of questions from this aspect in NEET MDS examination. So once you get the quick concept of it, it will be easy for you all to memorize it. Thank you.